50% of fax servers are broken today.
You either gotta like dedicate the staff and the energy and the time to adopt a technology partner, to adopt AI, or you're just not going to.
You're talking 98, 99% accuracy. Like it's probably better than most humans will actually do.
Kevin, welcome to the Co-Conspirator Track. It's great to have you part of the club. Why don't you give us a little background on you and your experience in DME, and then just kind of give us what's on the roadmap for Parachute right now. What are you guys looking forward to? What are you working on?
Yeah, thank you. So, I spent the past 20 plus years in the DME industry. Originally was a biomedical engineer.
Okay.
And realized that I didn't want to be in the bottom of a hospital.
Yes.
My entire career, I actually liked working with people and building things. So I was at a manufacturer, Medela, the breast pump company, for over 15 years. I had some great experiences. Started in the U.S., kind of building a new healthcare business for them in the wound care space. Spent 3 years in Switzerland with them, doing global development, working with other medical device manufacturers, and came back to the U.S. with them for a number of years. Where then I actually transferred over to Parachute.
Okay.
It was my experience actually at Medela that showed me the need for Parachute. We did negative pressure wound therapy, and these patients who have this great need for that product would sit in the hospital for 2 or 3 additional days, while the DME provider could get the documentation in order to help them get out.
Right.
And so when I left Medela, I went straight to Parachute and saw the value of expediting care, creating that clean order for a fast discharge, and I was sold on it on day one.
Where are you guys going? What are you excited about? What's on the roadmap?
Yeah, I think we've done a really good job in the world of e-prescribing. I think being the market leader there, people understand our name. I love it when I talk to our DME partners and they're like, we want that Parachute golden order. It comes in clean and it processes quickly. That's the great place to be. Obviously, though, getting every physician across the country or every health system on board, that's a journey. That doesn't happen overnight. And what we've realized is segmenting out those e-prescribed orders from all other referral channels is creating challenges for our customers, for our DME provider customers. And so what we are migrating to and already have available today and continue to iterate on is moving from just e-prescribing and being that kind of point solution into a full order management platform. Something that we can manage the inbound emails, we can manage the inbound faxes, we can help get corrections on those documentations that are broken. 50% of fax servers are broken today. We can help correct those through Parachute's native tooling that we've had for 10 years, while bringing the patient into that care, and even now bringing the payer into that care, so that the payer at the point of care can provide digital authorizations immediately, the patient can approve their therapy digitally, and the DME provider, whether it's a fax or an e-prescribed order, can work more quickly to process it and get that patient there.
So what do you think is the leading driver for adoption for you guys? What do you think has been that conduit that's helped you grow and helped you scale and meet the adoption you do have today?
It's a good question. I think, Parachute has always had a flywheel that we believed in. And being a marketplace, a two-sided marketplace fundamentally, we have always focused our value in ensuring that we're helping people on both sides of that marketplace. So inherently, we're helping the DME provider. They love that golden Parachute order, clean, fast, good. And we see those DME providers actively out there promoting, hey, order from us via Parachute, rather than just walking up and handing a fax form and continuing the craziness of a broken order. So the DME provider brings Parachute to the facility. But the great news is once that facility ends up converting to Parachute, they end up inevitably having other products that they need to order that maybe the initial DME didn't create. So then they're turning around and going to their DME provider saying, hey, we actually prefer as well to order via Parachute because the requirements are clear, the visibility on where the order status is and the ability to chat and communicate live on the platform helps them take care of their patients. So we have that flywheel that really kind of turns itself, and Parachute just watches our product to make sure that it's delivering value throughout that flywheel.
Yeah, it's a network effect. It snowballs really fast.
Absolutely.
That's awesome.
And the numbers are amazing. Again, I said them once, but thousands of DME providers, 280 something thousand doctors, and we watch it daily. Tens of thousands of doctors every month sign their first order on Parachute. And it just continues to grow.
So you have watched this adoption evolve over the years now. So has anything changed on how operators are viewing it, or is there friction there? How are you overcoming that friction?
Yeah, I think change is friction. Like
Yes.
when you're moving something, people are naturally wondering, like, what is this going to mean for me? Is it
Right.
good? Is it bad? I'm scared. I don't know. So I think that change is always there, and it's going to have a little bit of friction. But fundamentally, the value we end up seeing, or the need that we end up seeing, is taking your business from just being a fax intake business and moving it to order management or referral engagement creates so much more insight and collaboration across your organization to actually support your referral sources and your patients. So, the ability to tag in a sales rep effortlessly when an order is broken, and that sales rep might be walking in that office tomorrow, to give them the knowledge the second they're walking in and said, hey, Caleb, by the way, I've got one of your patients here that needs products, but you forgot to sign the prescription. Can you help me out? You're putting the tools in the hands of the team at the moment when they can use it so that your business can run more efficiently and you can provide better service.
So where is AI and automation transforming these workflows? Where is it working? What's not working? What are kind of your thoughts on that?
Yeah, it's interesting. We have a few initial applications of AI that are creating a lot of value for DME providers and clinicians alike, but I think it's just the start of it. I mean, just like there's a handful of AIs here today,
Yes.
I mean, how many are going to be here next year?
Right.
5 times the number of them, who knows?
Well, what are you guys doing on the AI side
Yeah.
that you feel like is working?
I think what's working right now is the ability, to go from e-prescribing to order management.
Okay.
Having the ability to take unstructured, dirty data on a fax and create something clean and organized out of it with no manual intervention to start.
Right.
Literally, we populate everything, we pull the data with, you're talking 98, 99% accuracy. Like it's probably better than most humans will actually do in that data pull.
Absolutely.
And making it so that then the DME provider can take advantage of all the integrations and workflows that we already have in place for them to prescribe.
Right.
So that's what we're already doing. But we've got ideas that can go deeper on that through publishing that AI capability upstream in the EHR. Because we do have such long-standing partnerships with the EHRs that we might be able to leverage our knowledge and our platform at the point of care, so the DME isn't like having somebody between them. The DME is actually brought closer to the care and is at the point of care and able to support the patients and physicians more.
Well, yeah, I think on the operations side, the less clicks, the better, right? The less portals, the less windows, the better, right? So it, sifting through different portals, different systems, clicking different menus should never be in the way of patient care.
Exactly.
So I love that mindset. That's our mindset here too, right? We don't even have a UI for that reason. We just want to push it through to the UI that matters to them,
Yeah, and I mean, it goes other layers and other directions as well. For us, it's interesting. We can look back and just already know that of the, hundreds of thousands of CGM orders that go on Parachute every month, we can tell you right now that X% of them also have a CGM, that same patient at some point in time has a CGM. So it obviously brings up the opportunity, like, can we get more into the predictive care opportunity of this?
Right.
Where we start to see the patient, see the whole picture of the patient by the notes that we're receiving, to actually help turn around and say, hey, have you considered? We like joking, the would you like fries with that model?
Right.
Like, oh, you have a CGM. Oh, by the way, there's an X% likelihood that you also have sleep apnea. Have you thought about having the patient tested for that?
Yeah.
And using the AI to be a little bit more smart to get there. So we're talking about those ideas.
Yeah.
Just at the point in time of where we are in care, there could be that opportunity, and I think it'll be interesting to see what comes forward over the next couple of years.
Yeah, and it's such a win-win too, right? Like the patient gets what they need. Also, that's an additional revenue stream for the HME that they may be missing, or Amazon may be taking from them, right?
Yeah.
If you're hitting them quick and hitting them fast, right? So.
Yeah, and I mean, and obviously DME, it's worth its weight in gold when we talk about dollars saved for the healthcare system.
Right.
Whether it's that walker that didn't show up that caused rehospitalization, or a CGM that helps a patient live their life more fully, it avoids costs. And so I think, we need to lean into the value of DME. We need to lean into the care that DME providers deliver. It's different than any other care setting in healthcare, where you have the DME providers who do this because they love it. They care about the patients, and they're out there servicing them at 2 a.m. on a Saturday morning when the oxygen goes out. I mean, I don't think my pharmacy is going to come out when I need my drug at that hour.
That's right.
I think leaning into that and providing them the opportunity to give the right care to the right patient more proactively will be better for all of us.
As a technology partner, what have you do you feel like you have a list of characteristics when you guys are trying to partner with other people, but also that you try and put forward when trying to partner with an HME or a clinician? What's that checklist? Like, what's that perfect partner for you guys?
Perfect partner. I mean, I think any partnership requires a willingness just to start. An acknowledgement that there needs to be change, a wantingness to do better.
Right.
You know, we can do e-prescribing, we can do order management with any of the DME providers out there, and they will get value out of it even if they don't necessarily change what they're doing, they just adopt Parachute. But the real leaps that we see are when these partners change their mindset and they no longer view operations and sales as two different pieces of an organization and order management just as an absolute little block to block workflow. But they start viewing order management as something that becomes a referral engagement, that becomes patient engagement, becomes payer engagement, and putting it in this full ecosystem and not just a single point solution. When they lean in that way, the value that they're getting out of the platform as a partner is it's exponentially more. So,
Absolutely.
When we're talking to new DME providers, there's a lot of discovery about what are you looking for?
Right.
How far do you want to go? Because we'd love to build even more.
We call them co-conspirators, right?
Yeah.
That's what we call them. So the guys like y'all, other providers, other service providers, technology providers, but also the HMEs, DMEs we're trying to work with, right? We're like, okay, are you truly dedicated to this? Do you have staff? Are you thinking budget-wise, right? And we don't want to waste anybody's time, right? Our time, their time. But you have to be committed, and that's kind of been a recurring conversation here. You can't just oh yeah, let's think about AI. You either gotta dedicate the staff and the energy and the time to adopt a technology partner, to adopt AI, or you're just not going to. You're just going to keep looking at the sidelines and just keep using ChatGPT all day, and that's it.
Absolutely. I mean, and we've done it so many times now with our DME partners that, I wouldn't say it's a science because every DME provider is different, but we have a formula.
Yeah.
And we're not talking 6, 12, 18-month implementation timelines. We can have people up running in a matter of weeks and building their own knowledge and building their own skill sets and really migrating their organization to be ready for the next 10 years and not necessarily living in the last 20.